So today let us discuss about a cracked tooth syndrome which is leading to the vertical root fracture. So here is a patient who reported to us to get the root canal treatment done because his previous dentist advised to get a root canal treatment done, and the same thing he told to us. So when I see clinically, there is a intraoral abscess and there is a fracture restoration and there is further decay too. So a radiograph has been done. Here you can see that there is a periapical and then the lateral lesion is there. Now look at closely at this tooth. So what you can see is there is one crack line also is seen. And apart from this, we can see that location of the intraoral abscess, if you look at it, it is present more towards the coronal third of the gingiva. So whenever this that kind of perilateral lesion, crack line, and the abscess which is in the coronal third of the gingiva, then I suspect that this crack line might be propagating towards the root too, because whenever we have the location of the abscess more coronally, it can be one is because of the gingival problem, or second thing is it can be because of the vertical root fracture. If it is a periapical lesion which is related to the root, then you would find it more at the apex of the root, that is more in the apical third of the root region. So since I suspect this, I don't promise the patient that 100% this tooth can be preserved with the root canal treatment, because even your CBCT, it can show you to certain extent, but then 100% you will not know that whether it is extending to the root or not. So I tell the patient that first let us start with the caries excavation and the crack dissection, and then let us see that whether it is going to the root or not. If in case it is going to the root, that we will know only when we do the access cavity preparation. So if it is going into the root, then the tooth requires extraction. If it is limited to the in the coronal in the crown portion, or even above the superficial to the CEJ, then still it can be preserved with the root canal treatment. So mentally I prepared the patient and then started with the caries excavation. You can see that the crack line here, it is there, further deep it is going. So I have gone further subgingivally, almost 2 millimeters, still the crack line is going down. So now when I check, it is going into the root portion. So now since it is going into the root, now nothing but we have to extract the tooth. So this I show to the patient that it is propagating into the root, so it requires extraction. So that is how we handle whenever there is a crack lines are present. Always that whenever you see such kind of intraoral abscess, suspect there may be a crack line, and tell the patient that we can tell you exactly where root canal can be done or not only after doing the access cavity preparation. Under the magnification, you confirm what is the crack line limit, accordingly you go ahead. I hope this video is useful to you.